Hello everyone. Today we will study one of the most important topic of the upper limb is the brachial plexus. Okay. From here you will see 1 minute. From here you will see the definition of the brachial plexus or a nerve plexus. It is a complex arrangement of the anterior rami of the certain spinal nerves. What is plexus? It is the arrangement of the anterior rami of the certain spinal nerves, allowing mixing of the nerves from different segments of the spinal cord. Okay, and giving branches carrying fibers from one or more segment of the spinal cord to supply the muscles and skin of the certain parts of the body. So, what is the nerve plexus? It is a complex arrangement of the anterior rami of certain spinal nerves, allowing mixing of fibers from different segments of the spinal cord and giving branches carrying fibers from one more than one segment of the spinal cord to supply the muscles and skin. So, here is the spinal nerves C4, C5, C6, C7, C8 and T1 and T2. This anterior rami of these spinal nerves, okay, forms the brachial plexus. Now, what is the brachial plexus? It is a big network of nerves which lies partly in the neck and partly in the axilla and is concerned with the innervation of the skin and muscle of the upper limb. So, what is brachial plexus? It is a big network of nerves originating from C4 region of the spinal nerves, C4, C5, C6, C7, C8, and T1 and T2. Okay, so now the most important part is the formation. Okay, the formation of the brachial plexus. It is formed of the anterior rami of the lower four cervical nerves. So, how many cervical nerves are there? There are 8 cervical nerves, C1 to C8. Okay, in this, the most formation of the brachial plexus, it is formed by the anterior rami of the lower four cervical nerves plus first thoracic nerve. Example is the C5, C6, C7, C8 and T1. It is this is the normal type of this is the normal type of brachial plexus. Okay, but the origin of the plexus may shift by one segment up by receiving a large contribution from the the origin of the plexus. The origin of the plexus may shift by one segment up by receiving a large contribution from C4. This is called as the prefix type of brachial plexus. Same wise, or origin may shift one segment down by receiving a large contribution from T2 segment. That is called as the postfix brachial plexus. Normally, the brachial plexus originate from C5 to T1, but when there is will be maybe shift from one segment up, receiving that contribution from the C4 part, that is known as the prefix type of brachial plexus. And when one segment down, that is from the T2, that is called as the post-fixed type of brachial plexus. Okay. Now the stages of brachial plexus. Here we have known about the formation. Okay. Now the stages of brachial plexus. The plexus consists of root, trunk, division, cord, and branches. The five portions. Okay, here are the five portions. This root, trunk, division, cord, and branches. Okay, here are the root, trunk, division, cord, branches. Now, up to this part. The plexus consists of root, trunk, division, cord, and branches as follows. First is the root, the stage of root, the stage of root. There are from the anterior rami of C5, C6, C7, C8, and T1. Anterior rami of this root. And how the trunk is formed? Trunk is formed from the three trunk: upper trunk, middle trunk, lower trunk. There are three trunks. Now the upper trunk is formed by the union of C5, C6 nerve root. The union of C5, C6 nerve root formed by a upper trunk. The middle trunk formed by the C7 alone. Okay, and the lower trunk is union from the C8 and T1. It is very much easy. There are how many trunks? Three trunks are there: upper trunk, middle trunk, and lower trunk. The upper trunk is formed by the union of C5 and C6 nerve root. The middle trunk formed by the only C7 alone nerve root, and the lower trunk is union of the root of C8 and T1. Now comes the division. First was the root. There are root are the C5, C6, C7, C8, and T1. Next was the trunk, upper trunk, middle trunk, and lower trunk. Number three is the, now you can see here, roots. The upper part of the posterior in the neck of the scalene muscle. How many roots are there? Five. Yeah, see, C5, C6, C7, C8, and T1. And this C5 and C6 form the upper trunk. Here, C5 and union of C5 and C6 form the upper trunk. Same way, uh, the C7 alone form the middle trunk. Next is the C8 and T1, union of C8 and T1 from the lower trunk. Okay. Now come to the division. Division here, each trunk divides into anterior and posterior division. Upper trunk divides into anterior posterior, middle trunk also anterior posterior division, lower trunk also anterior posterior division. From here the picture is the upper trunk divides into anterior and posterior division. Here, okay. Now here See here, anterior and posterior division, middle trunk and lower trunk. Okay. Now next is the cord. Okay. The plexus consists of three cords: posterior cord, lateral cord, medial cord. Okay. Post Posterior cord is found by the union of posterior division of the three trunk: upper trunk, middle trunk, and lower trunk, that contains fiber from all C5, C6, C7, C8, and T1. So how the posterior cord is formed? The union of the posterior division of the three trunks, all the three trunks: the upper trunk, middle trunk, lower trunk. The upper trunk, middle trunk, lower trunk divides into anterior and posterior division. Okay. Now next part is the cord. Cord three types of cord: posterior cord, lateral cord, and medial cord. The posterior cord is formed by the of union of posterior division of the three trunks. Three trunks means upper trunk, middle trunk, and lower trunk. Thus, it consists all the fiber, gradually all the fibers from the C5 to T1 nerve root. Now the lateral trunk. Lateral trunk is formed by the union of the anterior division. There was the posterior division, anterior division of the upper and middle trunk only. So upper and middle trunk means the fibers contained from the C5, C6, and C7. Because uh, upper trunk formed by the C5 union of the C5, C6 nerve root. Okay, and middle trunk is formed by the C7 nerve. So that's why C5, C6, and C7 nerve. Now the medial cord. It is formed by the anterior division of the lower trunk only, which contains C8 and T15. Okay, so basically there are three types of cord: posterior cord, lateral cord, and medial cord. Posterior cord is formed by the union of all the posterior divisions of the three trunks. Medial lateral cord is formed by the union of the anterior division of the upper and middle trunk only, and the medial cord is formed by the anterior division of the lower trunk only. Okay, so next part is the branches. Okay, the posterior cord gives five. The posterior cord gives five branches. Medial cord gives five branches, and lateral cord gives three branches. 5:5:3. Posterior cord 5, medial cord 5, lateral cord 3 branches. And it is to be noted that the root of the plexus also gives two branches of the upper limb. One is nerve to rhomboid and another is nerve to serratus anterior. And the upper trunk also gives two branches directly. One is the nerve to subclavius and another one is nerve to suprascapular or suprascapular nerve. Okay. Now we will see what are the five branches of the posterior cord, five branches of medial cord, and three branches of the lateral cord. Okay. 1 minute. Yeah. The branches of the cords. Branches of the cords are one is the medial cutaneous. The branches of the medial cord. Okay. Medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and root of medial and ulnar nerve. The branches of the lateral cord are musculocutaneous nerve and lateral root of the medial nerve, and the third part of the axillary nerve. and the branches from the posterior cord are the upper and lower suprascapular nerve, nerve to latissimus dorsi, axillary nerve, and radial nerve. So, what are the five nerves here? Radial nerve, axillary nerve, nerve to latissimus dorsi, upper subscapular nerve, lower subscapular nerve. These are the five branches of the posterior cord of the, and the three are the branches of the lateral cord, uh, are the musculocutaneous nerve, lateral root of median nerve, and third part of axillary nerve. And the five branches are the medial cutaneous nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, root of median nerve, and root of ulnar nerve, and third part of the axillary nerve. Okay? And now comes to the applied anatomy part, or applied anatomy part of the brachial plexus, which is the injury of the brachial plexus. It may be from the birth injury, excessive traction force applied to the upper lip during the labor, direct trauma, uh, from gunshot or from the fracture of the clavicle, fall from fast moving vehicle or motorcycle, the shoulder and neck are forced apart, and the fourth one is the cervical lip. The abnormal lip attaches to the large cervical vertebra. Okay. Here, the most important part, here two question comes. Uh, One is ops paralysis, okay, or ops palsy, and number two is the clumpus palsy. These two, okay, these two are the uh, what is ops palsy? Ops palsy is the injury to the upper trunk. Upper trunk means C5, C6. Okay, okay, and injury to the lower trunk is known as the clumpus palsy. Lower trunk means C8 and C1. Okay, the motor affection. Now we will read the portion of the half palsy. What is the motor affection? Paralysis of all the muscles supplied by the C5, C6 as follow. Paralysis of the abductor muscles of the arm, such as supraspinatus and deltoid, leads to abduction of the arm. Paralysis of the lateral rotator of the arm, such as infraspinatus and cerebrospinous, leads to medial rotation of the arm. And paralysis of the flexor and supinator of the forearm. What are the that biceps brachiolaterally leads to extension and pronation of the forearm. Now, in this half paralysis, we will see the deformity known as the Potter's deformity or policeman hips deformity. Okay, here is the position. See, this is the position of the Potter's deformity or policeman tips deformity. It is known as the policeman tips deformity because policemen gradually take tips in this position previously. Okay. Now the sensory loss, the loss of sensation over the lower one third of the deltoid and lateral side of the forearm. Now note is that the upper trunk of the brachial plexus is called as the ups point, which has six mate, two root, two branches, and two divisions. Okay. Now we'll come next part is the clumpus paralysis. Clumpus paralysis injury to the lower trunk, which is the C8 T1 part. What are the motor affection? Similar to the combined ulnar and median nerve injury. Okay. Here is the paralysis of the flexus of the fingers, wrist, except the flexor carpi ulnari, plus the paralysis of the all intrinsic muscle of the hand, These are the intrinsic muscle of the hand. What is the deformity in? Claw hand deformity. Claw hand deformity due to hyperextension of the metacarpal phalangeal joint and flexion of the interphalangeal joint. Okay. What are the sensory affection? Loss of sensation along the ulnar border of the forearm and hand. This question comes in the short notes. Okay, these tools are important for the Arps paralysis and the clumpus paralysis. Important for the short note. Now, well, it one more important part is the when you are reading the brachial plexus, you have to draw this picture. This picture. Okay, when the question comes, you have to draw this picture for the full attending of the question. Okay, you can take the screenshot and draw in your copybook. Okay? So this is it. This is the brachial plexus. Thank you, students.